Thank you so much for joining the We Don't Play podcast show today, Dr. Rabb. How are you?
Well, and yourself?
I'm great. You know, I'm so excited about this topic because a lot of people have questions. And, you know, people want to know what's the latest thing, how do people do things, and sometimes you have to hear from the expert, the professionals, so that you can fact check, because everybody Googles, everybody goes to YouTube, but nobody really knows the real truth. So this is great, you know, for you to be here with us today and joining us on the show.
Well, thank you for having me.
Yeah, anytime. We love people to know more about you, to tell them who you are, what you do, and how did you get to your defining moment, like through your career journey till now?
Well, I'm Dr. Carlnetta Rabb. I'm a family nurse practitioner, and I am an expert in post-surgery recovery of patients who's had a tummy tuck, liposuction, a BBL, as well as complications. A lot of patients, they seek me out because they are having a problem with a procedure that they just assumed that was going to be cut and dry. It was going to be easy. They would wake up from surgery in their new beach body, and it just doesn't happen like that, you know. And there's some other things that I do aesthetically, but right now the moment and focus is actually on these burning topics that we keep hearing about and post-surgical care.
Wow. Thank you so much for that insight. I think it's a great time for people to know, like you said, what the real process looks like, because no one sees that on Instagram. I mean, you might if you're lucky, but you don't see the process. Most times you don't see the process. You only see the result. You know, how do people scale back and start looking from within and ask themselves where to go to find information before they make those decisions and how they process them?
So a lot of it is, first, they got to start with the expectations. So a lot of times the expectations of, that's just like when you're buying a car. You know what you're looking for, you know, the color, the make, the model. It's really starting with what are you expecting out of the procedure that you're trying to have. And just like you said, a lot of things are not Googleable, a lot of things are not researchable. And the one thing is managing those expectations on how people think they should look versus what they actually look like getting off the table, and understanding that results take 90 days on a short side, 8 months on a good side, and if they're lucky, about a year. So they're not going to have that beach body in which they're looking for in a short period of time. So I really think that starting there, before you even start looking for a surgeon, is just really understanding what you should expect when getting off the table, because a lot of it is mental. And it's that mental aspect that really causes patients to second guess themselves, wondering what did they get themselves into, because they just didn't understand that they would not be getting off the table ready to go to work in a week or two. So
that's a big one. I think that's where people miss it, because they're looking at who's talking on TikTok, you know, and just saying this is why you do it quick. But when they now get to figure out who the person is to do it, also matters. It's like, you know, when people want to get stuff done, they go to the right person. So how do people find these other people that are not so experienced or educated to even educate their own people, their own community?
So a lot of times, I always say it is kind of hard because the waters are muddied. Everybody's an expert in everything, and everybody's selling something. I just say look for someone who's been consistently doing what it is that you're after. And that's in anything, right? That's in podcasting, that's in media. You want to find someone who actually has credentials behind their name, and hopefully somebody medical in a sense that is actually in post-surgery. All nurses don't specialize in post-op just because they're a nurse. And the same with the surgeon. You know, there's a lot of surgery centers that are now popping up. So to get a new surgeon, I wouldn't do it. You know, that's not something that I would do. Even if he has results that I like, I just would not choose that person, because we know, I will say what I know, the worst thing is managing a complication. So he can get you through the surgery, but what if something happens in the process? How can he think out something when he's new? It's very difficult. So I always say, don't go for someone who is a fad. Go for someone who's been ground rooted in the industry for a number of years.
Is there a number, like a minimum, or does it matter?
I don't want to overspeak for a surgeon. I can tell you from my perspective of what and how I judge. So I always say, find someone, meaning patient-wise. Find a patient that looks like you. Once you find a patient that looks like you, make sure he's done multiple people who look like you. Not just in size, but also in race. Make sure that they look like you. Make sure they're the same ethnicity, because now we're talking about keloids and scars and things like that everyone, they don't know how to cut on people of color. The next thing is make sure that he can reproduce over and over and over with the same body style. We don't want to just see one girl who is 200 pounds and then everyone else who he sees, they already have a perfect shape to start with. So it's not a lot of foundation that they have to work with. So always find that repeated pattern of over and over and over consistently. The other thing is reach out to one of these girls on social media. A lot of them, they'll tag these girls. A lot of them will tag themselves in a video. See if you can actually reach out to them and have a conversation. And number one thing, especially if it's a tummy tuck, the one thing, or breast, I want to see the incision. I always ask people, let me see your incision. That'll tell you a lot about a surgeon.
Why is that so important?
The reason is because, again, when we're talking about people of color, keloids. Every surgeon, people like to say people of color keloid because of the melanin. That's not true. It's the blade. It's how they cut you. Also, the way in which they can contour. A lot of people are left with what we call dog ears at the end of a tummy tuck incision. So if he's leaving all of his patients with this gap of a dog ear and they're not contouring well, then maybe that's someone, if that's a big deal to you, then maybe you may have to pass on this surgeon. I look for cuts and incisions that are even, that kind of have like this happy face look. Also, that it's not a cut like this, right? It can't be gathered on one side. We don't want it pulled tight here, but yet it looked like he fell asleep or something happened. Or he's so right-handed that when he got to the left side, it kind of gets a little weird. So it's things like that will tell you a whole lot about a surgeon. The other thing is looking at the incision, meaning you have to also see their skin in the process. So if you're looking at that patient's skin, because people are not going to just tell you, oh, he burned me. They're not going to say I had a wound. There's a lot of things that they won't say, but when you can see an incision and you're looking at a navel or a belly button, it will give you a better insight to what that patient looks like. And not only what the patient looks like, but the work of a surgeon.
That's so good. Thank you so much for that insight. Another thing came to mind as you were speaking is health, because health is wealth, and sometimes everybody has their own diet, their own routine, their own snacks, their own everything. How do you consolidate or accommodate or even suggest or help people when they have to think about those things, that they have to switch a little bit when it's kind of a struggle because the habit is not habitual?
Yeah, so first of all, it's expectations. We always start there. So people expect that just because they're having or going to have a procedure that it's going to be a fix-all, end-all. But cutting back on the bad habits before surgery, I know it's such a hard thing to do. So number one rules that I always give is don't drink your calories, meaning stay away from sodas. People say, I don't drink sodas, or cold drinks as we call it in New Orleans. They drink juices. You have to stay away from the sweet juices. The next thing is nothing fried and breaded. Find things that is going to be sustainable in the beginning of the process, because some people want to lose 50 pounds. They go have surgery and they balloon and gain that weight back because the fad diets that they were doing pre-surgery wasn't sustainable through life. So when I coach patients, I always ask them, now, is that sustainable? I want you to answer me. Eating salads for the rest of your life, is that something are you going to really do that? If the answer is no, the rules that I just gave you, nothing fried and nothing breaded, cutting back on rice and the pastas, and also don't drink your calories. If you can stay within inside of those rules, it gives people sustainability to figure out what works best for them. Oh, and smoking. They have to stop smoking. Smoking is not just for your lungs, obviously, but it cuts off circulation and blood supply to the incision, especially if you're gonna get cut. That cut has to have oxygen to rebuild itself. So if you're smoking, chances of you having a wound is very high.
Whew. That's a reality check for a couple of people, because I think the idea, like you're mentioning, one thing that really caught my attention was when you said don't drink your calories, because people love drinking 3 cans of soda, on a Tuesday. It's Taco Tuesday, why not? And then on Friday, here we go again. So 52 weeks in a row, times the number of years you've been doing it, it gets really like you can't really get that time back. So if somebody is looking back, they're like, man, I can't go back now. What do I do now? What should they start thinking about, and how should they start processing their next move?
I think the best thing to do is, I like to say, you didn't gain the weight all in one day. You can't lose it in one day. So it's just starting exactly where you are. And I think that's the simplest. Not Monday. Like you stumble, it's like one of those things to where you stumble, you may do okay, but you may not do your best. So sometimes we get discouraged. So we figure, I messed up today, I'm going to just wait till Monday. Well, it's Tuesday. So between Tuesday and next Monday, you've gained a lot of calories just in the process. I always educate, start where you left off at. If that means your next meal, just start at the next meal until you stumble better. And once you get rolling, then it becomes more of a consistent pattern. And people, I find, they do better like that.
That's beautiful. Thank you so much for that insight. Now, I want to even dive into, Cure Aesthetics, your business, when I think about that and I see other businesses do their practices, how would you say, cause people always ask questions that, okay, what's the difference between this company and that company? If they all do the same thing and they're all professionals and they're all experts, then who do I pick? How would you now demystify that for someone who is having those doubts?
So one thing about Cure Aesthetics is, when you say being an expert, people tell you get a degree, you're an expert. That doesn't make you an expert. I've been doing post-op well over 10 years. I've worked with surgeons. I've worked in the surgery centers, recovering patients directly from surgery. So I've actually got to walk through these processes to where now I can work through a problem. And the problem, as I said earlier, if you cannot manage a complication, it makes no sense to take on patients. So when I say Cure Aesthetics is the best at what we do for postoperative complications, I handle that with my eyes closed. I've worked in 3 different countries, America, Mexico, and Dominican Republic. So I've seen different processes, different surgeries, a lot of different complications. That has allowed me to broaden my knowledge. I get a lot of my training outside of the country as well. So it's not just having a one-track mind, it's being multiplex, because surgeons come from all over the world. And you don't just get the chance to say, I'm going to take one particular patient, because a body is like a car. You don't know what's under the hood until you get under the hood. So it's being able to anticipate. If a patient tells me where they're coming from, what country they're coming from, what doctor they're seeing, when the surgery is, I can almost anticipate the problems they're going to have or the problems they may not have. So I've been in this game a long time. I've seen surgeons come and go. And when I say come and go, even the ones that has been arrested for doing negligent things to patients, I have been able to anticipate where we're going to have a problem. And that way, once you're able to anticipate those things, I can better develop a plan for the patient outcomes to be so much better than they would have been.
That's amazing. And that's where you can start trusting people, and then telling one person to the other, before you know, the whole community is going to one person, and now the whole nation is connected, because it's that word of mouth. But people like to keep, it's like someone's best kept secret. Like, well, I don't want to tell her because I don't want it to look better than me, or I don't want to tell him, whatever the case is. I don't know. That's just me thinking out loud. But I feel like when people start really looking at giving quality, like you said, people start asking those questions, and sometimes they don't even know the questions to ask, because their experience is not to that point where they can actually validate those questions. So I think this is a really good way of putting it too.
Yes. And then for this type of business with post-op, it's very secretive. This is a very private moment. So I do find that my business does flourish with word of mouth, but it also suffers with word of mouth because no one wants to tell someone else that they've had plastic surgery. So that is where our business suffer at, because no one is just going to say, oh, you should go over there and see Dr. Rabb. She did my lymphatic massages, or she took care of my wound from my surgery. Now that's saying to the patient themselves that they chose the wrong doctor. Their body is not what it should be. So who wants to verbalize that I'm having an issue? So when it comes to things like that, people don't share. So we try our hardest to make every patient our priority. That way, and I find that in the surgery community, even if they don't want to tell people, sometimes when they run across another patient that is suffering, that is when our information will come up. So it's weird like that, but I am thankful for the ones who do say, hey, you should go there. I know you've been 10 other places, but that's the only place that's going to be able to take care of your complication.
No, I love that. And you also mentioned too, like leaving the country. People say Dr. Miami too, all the kind of, because it's social media. Everybody knows one surgeon. They don't know there's more than one, but people kind of centralize it on that one as the avatar, So when it comes to, creating those different things, there are different services, there are different, things that you offer. What are the different services or the most popular ones that people can come and say, okay, yeah, I got to go here. And then that's when they start to figure out, okay, you have a catalog and then there's more that you can offer. So, because it's that front, you can't go to the back of the house if you don't come to front of the house, So how does someone do that, and become, connected, at a faster rate?
Yeah. So, like I said, even though post-op, Botox, we do everything that's beauty here, fillers, anti-aging things. We do lipo-dissolve, which, no, it's not liposuction, but it does dissolve fat pockets. I mean, we have a host of services that, like I said, we are a wealth of knowledge. And we also do the non-surgical BBLs, which has been our top procedure that we've been doing. Patients who, again, has went to surgeons and they may have a little hip dip or fat has dissolved, and they want to fill or lift the area without the downtime. So that has been a plus for the community as well.
Okay, that's good. I love that. I really do. I think you also have something that people should know about, which is like their programs. Because, when you think about the pricing too, some people are like, I'm not ready for that. I don't want to do that. I'll do that in 5 years when I'm ready. People will think ahead, but there are systems in place to alternate or just give you better solutions. How does someone get into that, enroll in that, so they don't feel like they're spending their life savings on that when they think about the process,
So with us, we have Cherry Finance, and we do have in-house financing, which helps out with those things. And we do a treatment plan. Everything can't be done in one day. So we offer treatment plans so that the patient can better organize their time, their money, and do it in a sequence to what makes better sense for them. So it works like that as well.
Love that. Okay. That's good. Nah, this has been great. If there's one thing you want to tell the person listening that wants to make a decision, what should you tell them to start thinking about before they even get in contact with you or your team? I always say this is like the good girlfriend experience. What you see is what you get. We're very friendly here and we love what we do. So don't be afraid that you don't know the person who is in front of you or that you would like to book at. Understand that you are going to spend very great money here, and you don't have to worry about not being in a trusting and loving environment, because that's what we offer. Amazing. Nah, this has been good. Thank you so much for joining us on the show today. It's a pleasure. I know people want to connect with you. They're probably going to figure out, okay, now I want to take action. Where can they find you and how can they connect with you?
So we are on Instagram in our name, and I know you're going to post that. So that is Cure Aesthetics, KYUR, for those who are like, how do you spell it? Cure Aesthetics, and the name is the same way on every platform. That's on Instagram. And if you're trying to send an email, it is info@cureaesthetics.com. And the business name is Cure Aesthetics as well. So look us up. As long as you spell KYUR correctly, you will find us on all platforms, and we are ready to service you.
Amazing. Thank you so much, Dr. Carlnetta Rabb, for being here on the We Don't Play podcast show today. I've been your host, Favor Bassi EK, and I can't wait to bring you back again very soon.
Thank you for having me, Favor. It's been amazing. Thank you so much.
Anytime.
All right. Thank you.
Welcome.